Baltimore General, an episodic medical drama, written by Blue Bolton. Episode 1, Transfer of Care, Chapter 3. The double doors to Baltimore General's trauma bay crashed open, the sound echoing across the department as Emilia tucked her stethoscope into her white coat pocket. 47 minutes into her first shift, and already her senses were overwhelmed, the acrid burn of hospital coffee lingering on her tongue. The head nurse's dismissive Dr. New Girl still ringing in her ears, and the weight of 3 pages from departments buried somewhere in the labyrinthine floor plan she couldn't yet navigate. But the electric current of a critical incoming her body recognized this like an old friend. ETA 2 minutes on a teenage male, severe hemorrhaging with seizure activity, crackled a voice over the intercom. Trauma 1. Emilia's fingers worked her hair into a tight knot as she moved toward the bay, her footsteps quickening with purpose. Around her, the hospital vibrated with that familiar frequency, the controlled panic of trauma medicine, where order and chaos danced along a razor's edge. The trauma bay doors burst open again as the motorcycle woman in midnight blue scrubs cut through the space, her mere presence parting staff like water. She was tall and commanding. A resident scurried behind her, shoulders hunched, eyes wide. "Where's the chart on the incoming?" The woman's voice was low, but sliced through the room's chatter with an Afro-Cuban accent. "And why aren't the rapid infusers prepped yet?" A nurse's sneakers squeaked against the floor as she wheeled equipment into place. "We just got the call, Dr. Shaw." "And I got it 30 seconds ago in the surgical wing," the surgeon countered, the snap of her gloves punctuating her words, "which means you've had at least a minute to get this room ready." Dr. Shaw. The name had floated through the locker room that morning. Sloane Shaw, the trauma department's brilliant, difficult star surgeon. The nurse's descriptions had painted her somewhere between surgical goddess and human cheese grater. Emilia stepped into the light. "I'm Dr. Carter, new attending. I'll be running point on intake." Shaw turned, and Emilia felt herself pinned beneath that gaze, dark eyes dissecting everything from her freshly pressed lab coat to the sensible shoes on her feet in one clinical sweep. "New transfer," Shaw said, the words hanging between statement and question. "From where?" "DC General." Something dark flickered behind Shaw's eyes, a shadow of recognition that vanished before Emilia could name it. "Well, Dr. Carter from DC, Shaw said. "Baltimore General runs trauma differently. We move fast, we document properly, and we don't waste time on introductions when there's a critical incoming." The trauma phone shrilled. A nurse snatched it, listened, then called out, "They're pulling up now. BP 6040, pulse 130 and thready, multiple seizures en route." Shaw pivoted to address the room. "I want 2 large-bore IVs ready, type and cross for 4 units, and where's my trauma panel?" The bay erupted into controlled chaos. Emilia positioned herself at the head of the trauma bed, her mind automatically cycling through protocols like flipping through well-worn pages. CBC, coags, chem panel, and blood cultures. She directed a nearby nurse, her voice steady, "And let's have the rapid sequence intubation kit ready." Shaw's head snapped toward her. "Planning to tube the patient before assessment, Dr. Carter?" "Planning to be prepared," Emilia replied, her tone neutral despite the challenge. Hemorrhaging plus seizures often leads to compromised airways. The corner of Shaw's mouth twitched, not quite a smile, more a reluctant acknowledgement. She turned to her resident. "Park, walk me through your initial approach." The young resident's spine straightened. "ABCs first, identify bleeding source, control hemorrhage, then—" The bay doors flew open with a crash. Paramedics rushed in, their shoes squeaking against the linoleum as they wheeled in a stretcher bearing a teenage boy. Blood matted his hair, streaked his face, and soaked the blue fabric of his hoodie. Behind them stumbled a woman, her clothes splattered crimson, eyes wide with terror. Jordan Hall, 16, nonverbal autistic. The paramedic rattled off. Spontaneous hemorrhaging from mouth and nose, followed by seizures. No history of bleeding disorders per mom. Last seizure was 90 seconds ago. We've pushed 2 liters of saline, but he's still hypotensive. Emilia moved to the head of the bed as the team transferred Jordan to the trauma table. Each labored breath bubbled wetly in his throat. "Get me suction," she commanded, fingers closing around the laryngoscope. "And 20 of etomidate, 100 of succinylcholine." Shaw materialized at the boy's side, scissors flashing as she cut away his hoodie. "Where's his chart? Any medical history?" "No chart yet," a nurse called over her shoulder. "Mom says no prior bleeding episodes." The boy's mother pressed herself against the wall, her knuckles white. "He was fine this morning. We were just going to his appointment. Please save him." "Someone get her a chair," Emilia said, noting the woman's gray complexion. "And find out what medications he's on." Jordan's body suddenly went rigid, his back arching off the table like a bow being drawn. "He's seizing again," Emilia announced, her voice cutting through the beeping monitors. "Give me 4 of lorazepam." Shaw's hands moved with swift precision over the boy's abdomen. "No obvious trauma. This isn't external injury." Her fingers traveled up to his neck, then froze. "Neck's rigid. Carter, check his pupils." Emilia's penlight beam cut across Jordan's eyes. Fixed and dilated on the right. Her fingers probed his skull, feeling for abnormalities. "No obvious fractures, but there's increased ICP." Shaw completed her thought. "This is intracranial bleeding. Where's neurosurgery?" A nurse cradled a phone against her shoulder. "Dr. Mercer's in surgery. Next neurosurgeon is 20 minutes out." "He doesn't have 20 minutes, Shaw snapped. "Get me a portable CT now." Jordan's monitors wailed as his oxygen levels plummeted. Fresh blood poured from his nose, darker than before. "We need to establish an airway," Emilia said, positioning herself. "I'm going to intubate." Blood obscured her view, but Emilia's hands remained steady. She'd once guided a tube down a throat by feel alone during a blackout in a rocking ambulance. Difficult, but doable. "I'm in," she confirmed as the tube slid home. "Get him on the vent." Shaw leaned closer to the blood flow. "This isn't epistaxis. It's too dark, too consistent, coming from deeper." Her eyes narrowed to slits. "Where are his labs? And someone pull his medical records." A nurse approached, a tablet glowing in her hands. "Records are still being transferred from his pediatrician. Lab results are coming up now." Shaw snatched the tablet, her fingers scrolling rapidly. "Platelets are 20,000. That's critically low. His clotting factors are shot." She looked up, jaw tight. "He's in DIC. We need platelets and fresh frozen plasma, stat." Emilia's fingers adjusted ventilator settings. "What triggered the DIC? No trauma history, no obvious infection sites." "That's the question," Shaw muttered. She turned to Jordan's mother. "Has he been sick recently? Fever, rash, anything unusual?" The woman shook her head, tears carving paths through the blood spatter on her cheeks. "Just headaches. The doctor said it was migraines. Gave him medication last month." "What medication?" Shaw and Emilia demanded in unison. "I don't remember the name, something with a V." Ice slid down Emilia's spine. "Vascatril?" The mother nodded. "That's it." Shaw's head whipped toward Emilia, their eyes locking. Something electric arced between them: recognition, alarm, a shared knowledge that tasted like copper pennies. When did he start taking it? Shaw demanded. 4 weeks ago. Why? Is that causing this? Shaw ignored the question, turning to her resident. Park, get a complete drug history and check for any other patients admitted with similar symptoms in the last 3 months. The portable CT arrived with a squeak of wheels, and the team maneuvered Jordan into position. Talk to me about Vascotril, Shaw murmured to Emilia as they waited for the scan. New migraine preventative, Emilia replied, keeping her voice low. FDA approved last year. There were some concerns about platelet suppression in the trials, but nothing like this. You've seen this presentation before. Again, not a question. Emilia hesitated, the memory flashing behind her eyes. Similar, at DC General, 14-year-old girl. She didn't make it. Something darkened in Shaw's expression. Recognition or suspicion. Emilia couldn't tell which. CT's ready, called a technician. The images materialized on screen. A massive bleed spilled across Jordan's right hemisphere, like milk across a kitchen floor. Jesus, Shaw breathed, the word barely audible. That's not survivable without immediate intervention. She spun to address the room. Call or2 and tell them we're coming up. I need a craniotomy tray, mannitol, and hypertonic saline. And someone find me a neurosurgeon, even if you have to drag one in from the street. The mother crumpled into her chair, her sobs echoing off the tile walls. A nurse rushed to her side. Dr. Shaw, Emilia said, even with surgery, with platelets this low and DIC. I'm aware of the odds, Dr. Carter, Shaw cut her off, but I'm not declaring this boy dead while his heart's still beating. The team prepared Jordan for transport, Shaw's commands cutting through the chaos with military precision, orchestrating a complex transfer with the calm of someone who had walked this knife's edge countless times before. As they wheeled toward the elevator, Shaw fell into step beside Emilia. You're coming up. I'm ER, not surgical. You recognize the drug connection. I want your eyes on this case. Shaw's gaze bored into her like a drill bit. Unless you'd rather stay down here and wait for the next trauma to roll in. The words hung in the air, not really a question. A test. I'll page Dr. Winters to cover the ER, Emilia said. In the elevator, Jordan's vitals spiraled downward despite their interventions. His mother's sobs still echoed in Emilia's ears as the doors sealed them in. Tell me about your DC case, Shaw demanded, her eyes fixed on the climbing floor numbers. Same presentation? Similar: epistaxis, seizures, intracranial hemorrhage. Her platelets crashed within hours of admission. And she was also on Vascotril? Yes, 3-week history. Shaw's jaw muscles bunched beneath her skin. Was it reported? Of course. I filed with the FDA myself. And? And nothing. The case was deemed inconclusive since she had other medications on board. The elevator doors parted to reveal the surgical floor, where staff waited like soldiers at attention. Or2 is set, a nurse announced. Dr. Mercer finished his case and is scrubbing in. Finally, some good news, Shaw muttered. She turned to Emilia. Scrub in, Dr. Carter. I want to see what you can do when you're not just pushing tubes down throats. The surgical prep area buzzed with activity. Emilia tied a surgical mask over her face, feeling Shaw's eyes on her from across the room. You know, Shaw said, her voice pitched for Emilia's ears alone. Most new transfers spend their first day getting lost between the cafeteria and radiology. Not many identify potential pharmaceutical catastrophes before lunch. I'm not most transfers, Emilia replied, meeting that penetrating gaze. Clearly, Shaw's eyes narrowed slightly. Which makes me wonder why you left DC in the first place. Before Emilia could respond, the neurosurgeon swept in silver-haired Dr. Mercer, his presence filling the room. What do we have? He demanded, eyes scanning the CT images now displayed on the OR screens. 16-year-old with spontaneous intracranial hemorrhage, likely drug-induced coagulopathy, Shaw reported. DIC, platelets at 20,000, pressure building fast. Mercer studied the images, his frown deepening with each second. That's a massive bleed. Who's the surgeon of record? I am, Shaw stated. You're not neurosurgery. And you were unavailable when his brain started leaking out his nose. I've done enough cranial procedures to get started. You can take over once we're in. Mercer's face tightened, then relaxed into grudging acceptance. Fine, but this is a Hail Mary at best. As they entered the OR, Emilia found herself positioned across from Shaw at the operating table. Jordan lay between them, his face now clean but ashen beneath the harsh surgical lights, his youth painfully evident. BP's dropping again, 50-30, a nurse called, urgency threading through her voice. Push another unit of platelets and start the plasma, Shaw ordered. Her eyes locked with Emilia's over their masks. Ever assisted on a craniotomy, Dr. Carter? 3 times. Good, because this won't be textbook. Shaw extended her hand. Scalpel. As steel met skin, Jordan's monitors erupted in shrill alarm. His heart rhythm disintegrated on the screen. V-fib, Emilia called out. He's crashing. Shaw's hands never hesitated. Starting internal compressions, push one of epi and charge the paddles to 200. The team swarmed into action, but Emilia saw the truth in the monitors, in the widening pool of blood, in the grim set of Mercer's mouth. They were losing ground with every passing second. Shaw worked with ferocious intensity, her hands steady even as Jordan's vitals spiraled downward. There was something almost beautiful in her precision, her refusal to surrender to the overwhelming odds. Come on, kid, Shaw whispered, the words barely audible. Don't quit on me now. The monitors continued their ominous chorus as the surgical team battled against time and biology, the air between them thick with technical jargon and the unspoken knowledge that they were witnessing the beginning of something that reached far beyond this operating room, this patient. Across the table, Shaw's eyes met Emilia's again, and in that moment of connection, Emilia felt that she hadn't simply started a new job at a new hospital. She'd walked into the middle of a story already unfolding, with Shaw at its burning center.